This week, the U.S. celebrates Juneteenth, the emancipation of people who have been enslaved. But systemic racism still exists today, and the pandemic exposed and amplified those disparities, especially in healthcare. Amanda Quintana looks at the inequities we are seeing now.
There's vaccination pop-ups all over our community, but that has not yielded the results that we need as a community in order to get on top of this.
Black people make up about 7% of Wisconsinites, but of those fully vaccinated, they only make up 3.5%, even though the community was especially plagued by COVID, making up 12% of the state's hospitalizations.
It went from, a notion or a report on TV to actual data, actual death.
Annie Weatherby Flowers, founder of Madison's Juneteenth event, says the virus highlighted disparities that were already there, like a lack of access, not just to physical care, but to information.
How do we help our community with social and personal responsibility? One of the ways of that is you connect folks to truth.
That's happening through virtual sessions Friday with doctors and experts on reclaiming the narrative around Black health.
Talk about the dynamics of what it's going to be like moving forward now that we've seen and experienced a global pandemic, and what that means for Black Americans and the Black community locally.
Joshua Wright with the Carbone Cancer Center will help moderate these public discussions, not just on COVID, but some of the issues that made Black Americans more susceptible to COVID.
Diabetes, heart disease, stroke, those kinds of things that you're talking about, Alzheimer's, cancer, these are all the different conditions that the Black population has experienced in this disproportionate outcome.
A learning experience for both attendees and doctors.
If we are at the table and we're informed, and if we are able to inform doctors around, what's our unique symptomology or perceptions about health and health-related issues.
Right now in Dane County, under 34% of the Black population have had one shot. Compare that to 53% of the Latinx community and 62% of the white community. A big reason why organizers asked UW Health to set up a vaccine clinic on Saturday.
Definitely. We want to refocus efforts.
Shiva Badar, UW Health's Chief Diversity Officer, says the goal is to make people comfortable and answer questions, understanding the hesitancy.
Just a general mistrust of government and systems and health systems and healthcare because of really both a history of harm that has happened, but also the current harm, right? Racism exists currently.
Amanda Quintana, News 3 Now.
That vaccine clinic will be at Penn Park during the big parade on Juneteenth, but virtual events begin tomorrow.